It's novel CAR T-cell therapy for hematological malignancies from Dr. Huang from Hangzhou in China.
Yeah, and first I'd like to thank you, Professor Anna, and the organizer committee invited me to come here. It's a wonderful meeting and a beautiful city. So today I'd like to talk about the novel CAR T therapies. We all know that CAR T developed the 10 years and it's the revolution of the clinical medicine. Until now, there's 10 industrial CAR T in USA and China. And China have the 4 CAR T focused on the CD19 and the BCMA CAR T can commercially use the clinical practice. Also, the outstanding efficacy of the CAR T therapy focused on acute lymphocytic leukemia, multiple myeloma, and lymphoma. But until now, we have some of the challenges in CAR T therapy for hematological malignancies. One is the high resistance of relapse, so we need to enhance the function of the CAR T cell. Another is the limited target. We all know that just the CD19 and the BCMA conventional CAR T, so we need the novel target for CAR T cell. Another in the individual manufacturing, and we need the university CAR T cell. So we'd like to talk about and first enhance the function of the CAR T cell. And the no virus specifically targeted CAR T cell achieved high safety and efficacy in the non-Hodgkin lymphoma. We designed the PD-1 integrated CAR T cell can be successfully generated CAR T expression and PD-1 disruption. And then PD-1 integrated CAR T cells shows a better expansion. And the animal model shows the comparing with another, just like the knockout. We can see the no virus PD-1 integrated CAR T cells vary in results. And the phase 1 clinical study shows is the minor complication, no ICANS, no grade more than the 3-4 CRS, a high complete remission. About the non-Hodgkin lymphoma, 87% patients reached the complete remission. And we can see the all patient expansion. And for the eradication of the large tumor mass and the single cell assay shows is the retains the expansion of the memory-associated molecule. So in further, we will, after the Nature publication and the last year, we finished in cohort, the 30 patient and the screen. And we can see all the best CR and any 10 point is 80%. And the overall response is 95%. So we will conclusion and the no virus PD-1 integrated CAR T and simplify the manufacturing and no latent integration, reduce the production and increase the efficacy. Another we'd like to talk about is the new target. And we all know the BCMA is effective for the multiple myeloma with publication and cancer clinical cancer research, and there's a CR about the 70%. But we all know about the half patient will relapse, and especially the high risk cytogenetic action medulla and the light chain patient is the high incidence of the relapse. So GPI5D is reasonable the new target because the expansion of the multiple myeloma suffers. And the anti-tumor effect and confirm the preclinical model, and also we will finish the clinical study. And we can see here the half patient is the fail after relapse of the BCMA CAR T therapy. And the overall response is 100%. The complete remission is 60%. Very good partial is 40%. So another we'd like to talk university, and the university CAR focus on CD7 because it's the CD7 is the great challenge, the fratricide and the contamination of the tumor cell and the T cell pressure. And so we designed the university CAR T focus the CD7. And first the CD7 knockout, TCR knockout, HLA knockout, and the avoiding the activation of the host NK. And such the universal CAR T focus on the CD7, the clinical study shows no dose-limited toxicity, and the clinical study shows the overall response at 82%, and the leukemia patient the complete remission is 75%. So the follows flow cytometry and the qPCR, we should see the expansion and maintain on about the 30 days, and the CD7 negative T cells has the amplitude of the expansion. So we have the node strategy and the CD7 CAR-T integrated with the haploidentical stem cell transplantation. We all know the novel all-in-one strategy that is the integrated CD7 CAR-T for the CD7 positive hematological malignancies, including the leukemia, lymphocytic leukemia, and the myeloid leukemia. And after the CAR-T therapy and the CD7 CAR-T delivered such as malignant cell, and then transfusion the haplo donors stem cell. And such the strategic advantage is condition free and the GVHD prophylaxis free, and the long-term CAR-T cytotoxic, and the long-term GVHD effective. So the 1 year, and we can see the median of survival and the disease-free survival is the 1 year is 67% and the 4%. So how about the CAR-T therapy in China? And last year we published the Lancet Haematology review about China's CAR-T therapies. And when we can see the clinical study is developed very fast, and we can see here every year about the 340 cases. And the majority is the IIT study, and the phase 1 and the phase 2. And 80% is focused on the hematological disease, and 20% is about the solid tumor. And in the hematological malignancies, and about the 80% is the B, focus B is the lineage. 10 focus on the T lineage, and the 10 about the myeloid lineage. And the innovation target, and we can see here the many target about the B cells, NKT cells, myeloid, and the hepatic cancer, and the cancer, the pancreatic cancer, and the brain cancer. So another point, and I'd like to say China, and beyond the hematological malignancies, autoimmunity disease is the next disease treated as CAR-T therapies. There are many clinical studies, just like the SLE and the scleroderma and the immunonephritis and the point syndrome, and there are some clinical study. So finally, I'd like to thank you all the teams and the clinical teams and the laboratory team, also the Viva Corporation, the biological company, and also the involving the clinical study, patient and the family. Thank you. Thank you for your attention.
Thank you very much.